Chapter 4, Moral Character. Good day, everyone. Today we turn our attention to one of the most human and heart-centered components of ethics, moral character. In the previous chapters, we explored ethical theories and moral norms. Those chapters focused on what we should do, but this chapter asks a different question. What kind of person should we be? This question of character is at the core of ethics, because when the rules are unclear and when principles collide, it's the character of the person that often determines what happens next. In healthcare and in life, people don't just respond to rules, they respond to who you are, your integrity, your compassion, your trustworthiness. That's the power of character. So, let's dive into Chapter 4, Moral Character. What is moral character? Moral character refers to the stable traits, habits, and dispositions that shape a person's behavior. It's not just what we do once, but what we consistently choose to do over time. Character is not about being perfect. It's about being formed, reliable, and aimed toward the good. Dr. Cohen highlights that moral character is a deeply personal dimension of ethics. It's about cultivating the kind of person who naturally and habitually makes good choices, even when no one is watching. Let's discuss ethics of being versus ethics of doing. To understand moral character, it helps to contrast two kinds of ethics. Ethics of doing, focused on actions, rules, duties, and consequences. This is where most traditional ethical theories reside. Ethics of being, focused on the moral agent, their virtues, motivations, and personal growth. The ethics of being is central to virtue ethics, an approach we encountered in Chapter 2. This perspective, rooted in thinkers like Aristotle and Thomas Aquinas, asks not just what should I do, but who should I become? In healthcare, this is vital. A doctor can follow the rules but still act with cold indifference. A nurse can obey policies yet lack empathy. What truly changes outcomes, what builds trust, is character, components of moral character. According to Cohen, moral character includes virtues, stable traits that incline a person to do good. Moral sentiments, emotional responses that reflect moral awareness, like guilt, empathy, or outrage. Moral motivation, the drive to act on ethical convictions, even when it's hard. Moral courage, the willingness to take risks for what's right. Let's explore each of these in turn. 1. Virtues. Habits of the good. Virtues are at the center of moral character. They are not just feelings or intentions, but deeply rooted qualities of the soul that shape consistent ethical action. In our book, I list several core virtues for healthcare professionals. Honesty, telling the truth even when it's difficult. Compassion, entering into the suffering of others with care. Integrity, being the same person in private as in public. Respectfulness, honoring the dignity of each person. Courage, doing the right thing in the face of fear or adversity. Virtue is developed through practice. It is formed over time through small, repeated choices. Much like muscles are strengthened at the gym, virtues are built through consistent moral training. In the words of Aristotle, we become just by doing just acts. 2. Moral sentiments, the heart of ethics. While virtues shape our behavior, moral sentiments shape our emotional responses to moral situations. These include empathy, feeling with others in their suffering. Guilt, a moral emotion that alerts us to wrongdoing. Shame, a painful feeling about who we are when we've violated our values. Anger, especially in the face of injustice. Cohen emphasizes that emotions are not irrational or opposed to ethics. In fact, they are often signals of moral truths. A nurse who feels deep sadness at a patient's suffering is morally alive. However, moral sentiments must be guided by reason. Guilt, for example, can be healthy, but it can also become destructive if not processed properly. Mature moral character involves balanced emotional sensitivity, feeling deeply but not being ruled by emotion. 3. Moral motivation. Choosing the good moral character requires motivation, a desire to pursue the good even when it is inconvenient, costly, or unpopular. Cohen distinguishes between extrinsic motivation, doing good to earn praise or avoid punishment, and intrinsic motivation, doing good because it is right. The highest form of ethical maturity is internalized morality, where right action flows from within. In healthcare, this means treating all patients with dignity even when no one is watching. Following protocols because you believe in their moral worth, not just because it's required. Going the extra mile, not for recognition, but from conviction. This kind of motivation creates ethical resilience, the strength to act with integrity even under pressure. 4. Moral courage. Doing right, under fire. Moral character is most visible when the stakes are high. This is where moral courage comes in. Moral courage is the willingness to take risks to do what is right. It often involves speaking truth to power, advocating for vulnerable patients, challenging unethical behavior, standing alone when necessary. Cohen reminds us that ethical practice is not always comfortable. In fact, people with strong moral character may face ridicule, retaliation, or isolation. Yet courage is contagious. When one person stands up, others often follow. A doctor who refuses to participate in discrimination, a nurse who reports patient abuse, a technician who refuses to falsify data, these are acts of moral courage that define character. The role of conscience. An important part of moral character is conscience, our internal sense of right and wrong. Conscience acts as a moral compass. It is shaped by upbringing, culture, education, faith, and personal reflection. But as Cohen points out, conscience can be well-formed, aligned with reason and truth, ill-formed, shaped by prejudice, ignorance, or fear, overactive, overly scrupulous or guilty, underactive, numb or indifferent. Developing moral character involves cultivating a well-formed conscience, one that is both tender and wise. This requires ongoing reflection, dialogue, and self-examination. It also requires humility to admit when we're wrong and the courage to change. Moral failure and growth. No one has perfect moral character. We all fail, sometimes in small ways, sometimes in large ones. But Cohen stresses that failure is not the end. In fact, moral character is often forged in the fire of failure. The key is how we respond. Do we make excuses or take responsibility? Do we hide from guilt or learn from it? Do we grow bitter or become wiser? Moral character is not about never falling. It's about rising again with integrity. In this way, ethics becomes a journey, not a destination, a path of growth, repentance, and renewal. Formation of character. So how is moral character formed? According to Cohen, it happens through education, learning ethical principles, case studies, and moral reasoning, role models, watching mentors and professionals who embody virtue, practice, repeatedly making ethical choices, even in small matters, reflection, examining one's motives, actions, and emotional responses, community, being shaped by a culture of integrity and accountability. This is why professional formation is not just about technical training, but about moral development. A healthcare worker is not just a skill provider, they are a moral agent. Institutions must foster environments where character can flourish through support, mentorship, and ethical leadership. The legacy of character. At the end of life, most people don't wish they had more money or fame. They reflect on the kind of person they became. The same is true in healthcare. When a patient says, "That nurse really listened," or "That doctor treated me like a person, not a number," they are not talking about technical skill. They are describing moral character. Cohen reminds us that ethical influence often comes not through argument, but through presence. A clinician who radiates integrity, compassion, and courage becomes a source of healing beyond medicine. In short, character is contagious. It shapes how we practice. It shapes how we lead. It shapes how we love. Conclusion: becoming the kind of person. As we wrap up this chapter, let me leave you with this reflection. Ethics is not just about decisions. It's about disposition. Not just about doing good, but becoming good. And that's what moral character is all about. So ask yourself, who am I becoming? What virtues am I practicing daily? How do I respond to failure? Who are my role models? What kind of moral legacy will I leave? Because at the end of the day, our greatest gift to others may not be our knowledge or skills, but our character. Thank you.